episode of the BioHub. Today, we're super excited to welcome Nicole Lambert. Nicole is a business leader with over 2 decades of experience at Myriad Genetics, where she played a pivotal role in advancing genetic testing and precision medicine. Recently, she transitioned from her role as Chief Operating Officer to focus on new professional opportunities and continues her impactful work as a senior advisor and board member of Arcus Biosciences. I first met Nicole when she messaged me on LinkedIn about exploring board roles, and I had the absolute pleasure of placing her with Arcus Biosciences. Today, we're diving into some fascinating topics. We'll explore Nicole's journey at Myriad, how she stayed motivated, her personal connection to genetic testing, and the challenges and successes she faced in her career. Nicole will also share some insights on handling burnout, the role of women in biotech, and the future of healthcare. It's an absolute pleasure to welcome Nicole Lambert.
Thanks, Max. Excited to be here.
Absolute pleasure, honestly, real pleasure. So, Nicole, your career at Myriad, incredibly successful. Just starting as an account executive and then eventually becoming the chief operating officer. What are some of the key moments or strategies that helped you climb the ranks?
Sure. And I had the fortunate time to be at Myriad where there were lots of opportunities to change roles. We were expanding businesses, going into new specialties and developing new tests. So I had a lot of opportunity for professional development. I think the strategy that served me best, though, was, in taking on another opportunity, always have a part of the job that you know really, really well, and then a part of the job that you don't know anything about that you're going to learn, right? So for instance, I started out, a lot of my career at first I started out as a medical science liaison because I was a genetic counselor. So I knew a lot about the science and the genetics, but I didn't know anything about industry. And then as I got into that role and I transitioned over to sales, I knew the products, I knew the customers. I just had always interacted with them in a medical capacity instead of a sales capacity. So I was able to learn that. And then, as I got further into my career, I changed to sales in a different specialty. So I knew a lot about sales, but I maybe didn't know a lot about the newer products. And then as I moved on, I moved back into oncology in a marketing role where I knew the products and I knew the science and I knew the customers, but I didn't know anything about marketing. And so it allowed me to develop those skills. And so that strategy, I think, has served me through lots of different moves at Myriad where, there's an opportunity to be an expert and to not feel like you're completely, unqualified or failing at something. But then you also have this great opportunity to learn a whole new skill set that will serve you as you go forward into your career. And so you take a lot of sort of different moves, lateral moves sometimes, but they build the skill set that you need to move up the ladder.
Nice. Yeah, there's always that element of imposter syndrome is what we call. I don't know if that's a common theme in the US as well.
Yes.
It's what we call it in the UK, where
Yes, it is very common in the US.
Yeah, it's like you feel like you shouldn't be there yet. You've always got to have that feeling inside of you to progress.
Yes. And I know Sheryl Sandberg had this great quote about it's not a corporate ladder, it's a jungle gym. And so those lateral moves too really help you understand a new role where you feel like, okay, I know 80% of this job and I'm just going to give myself grace on the 20% that I don't know. And then you make enough of those lateral moves and pretty soon you know all the different disciplines that go into a move up the ladder.
Yeah. And then I suppose same with Myriad for over 2 decades in the end. I know in my industry, just from looking at profiles, that's pretty rare, especially in biotech, pharma. But what kept you motivated and engaged with Myriad for so long?
Sure. So the number one thing was the science. I always had a lot of faith in the science that Myriad did and that it was, best in the industry. So I always really believed in the science that we were doing and the mission that we had for patients. I felt like the products and the tests that we came out with were best in class, they were best across the industry, or they were new and novel. And they really genuinely made a positive impact on patients. So I think that was first and foremost for me. Is I came into Myriad as a genetic counselor, and I needed to believe in the science and the difference that it was making for patients. And I always had that at Myriad. And so I was very fortunate with that. But then also, I was at Myriad at a time where we were really diversifying. When I started at Myriad, we were just testing for hereditary breast cancer with the
Okay.
BRCA1 and BRCA2 genes. But over the time that I was there, we went into a lot of new specialties. We developed a new prostate cancer test. We developed a new test for melanoma. We, acquired a women's health business. So we went into all different, specialties and disciplines. There were always new disease states to learn about, new different patient types to learn about. And so I was constantly learning, constantly challenged, and constantly, had a new way to impact patients, even though, my parking spot stayed the same.
I mean, it must have been so rewarding because when you joined Myriad, I don't know the size, but they obviously grew significantly in terms of the science they took on and the headcount. That must have been fascinating just to see it go like that.
Yes, it really, I mean, when I think about it, when I joined Myriad, we would only test a couple patients a day, right? And, it took us the first, 5 or 10 years to test 1 million patients.
Hmm.
Now we test 1 million patients every year, right? So the size and scale is so different. When I started, it was a $16 million company. And, when I left before the pandemic, it was an $850 million company, right? So the
Wow.
scale of it just really exploded. And, in the beginning, it was, as I said, just really breast cancer patients and, patients that had these really strong family histories. They had 4 sisters with breast cancer and that type of thing. And over time, we started helping all different type, patients that had mental health challenges, patients that
Wow.
had challenges with deciding on prostate cancer treatment, patients that were doing carrier testing in advance of a pregnancy. I mean, there were all different ways to impact patients. And so that's probably what I'm most proud of at Myriad is the growth and development and the impact that the company had over the time that I was there.
How did they do that? I mean, in terms of like from a couple of patients a day to growing to that scale, I suppose there's
Yes,
elements of
a
luck
lot
or
of hard work, honestly, a lot of hard work and a lot of really changing the paradigm, right? Because in those early days, if you wanted BRCA testing or really any type of genetic testing, you had to go into an academic center like Sloan Kettering or MD Anderson. There might be, a 3-month wait
yeah.
for that. There were only a few genetic counselors that could see those patients. It was a pretty arduous process in terms of pre-test counseling. The testing took a month or so, and then you'd have your post-test counseling. So it was a really labor-intensive type of process. And what Myriad was able to do was really make that process much, much more efficient in a number of important ways, right? Shrinking the time it took to do the testing from 5 weeks to 1 week, right? So making that lab process much more efficient. And then I think working out in the communities with genetic counselors, but also with, in the early days, breast surgeons and oncologists to say, okay, probably not every patient needs to go into the large academic medical centers. There are probably
Yeah.
a lot of patients that can be tested out in the community and save the complicated cases for those academic medical centers. And so over time, now if you look at today, patients are able to just go into their regular OB-GYN and, give their family history and get tested. And in the early days too, it took a long time to get insurance to verify, and you had a long time to pre-authorize testing. And now, it's very straightforward criteria. If you meet the criteria, your OB-GYN can just order the test that day. So attacking it from multiple different, layers, but overall just making the process much simpler and accessible for patients.
Yeah, and then you've actually got a personal connection to Myriad's mission as well, given your family's history of cancer. Uh, how has that affected, I suppose, your professional approach and the decisions you made while at Myriad?
Sure. Well, it definitely, increased my sense of urgency. When I joined Myriad, I really didn't have a family history of cancer. I had to go back several generations before I found someone with a stomach cancer. We didn't have a family history of
Wow.
breast cancer. So it wasn't something that was on my mind, right? Or it wasn't personally as urgent for me when I first started. But over the years that I was with Myriad, my mother had breast cancer twice, and her youngest sister died of metastatic
Wow.
breast cancer. And so all of a sudden, I did have this strong family history. And, I remember when my mom was first diagnosed, I thought, she was in her 60s. It wasn't your classic presentation of hereditary breast cancer. So I honestly didn't think that much of my own family history. But, as she was diagnosed a second time and as my aunt was diagnosed, it became a lot more obvious. And then I went through testing, which, was meant to be preventive. And I went through preventive surgeries based on the results of that testing, and found out that I already had two breast cancers. When I got the final pathology report, they realized that I had already had two cancers, and so if I had not done that, I would have a very different trajectory, right? I would be going through treatment and chemotherapy, and I have a young son, so it would have really impacted,
Yeah.
my ability to show up and be a good mom for that period of time. And so all of a sudden, I had a lot more urgency around, for me, guidelines, because I think previously professional guidelines would say, patients aren't appropriate for testing unless they have, two or three family members with breast or ovarian cancer. If they had, breast cancer under the age of 50. I mean, the criteria were still pretty tight for a family to get testing. And after going through my own experience, what I realized was we shouldn't be waiting that long. If we had just, even though my mom was in her 60s, like if we had tested her right away, if we had tested the rest of the family right away, we might have prevented, what my aunt went through or what I had to go through, and that type of thing. And so I realized, like, we shouldn't be so academic and discriminate about who qualifies for testing. We really should be identifying these patients much earlier with a much broader criteria so that we prevent those younger generations from having to go through this.
That's a crazy story when you think about like how you ended up at Myriad and then it all became much more relevant. And it just shows how important the work Myriad are doing. It really is. Like
Yeah.
it just really shows.
Yes.
Um,
And so that, of course, is a easy way to keep me motivated there as well.
I can imagine. I can imagine. I mean, I suppose it resonates with so many more people when you've got that and you're selling something you are truly passionate about.
Yes.
Rightly so.
Yes.
Um, I mean, I don't mean to completely change the subject from that because it's incredible. But the next question was on one of the, actually on burnout and high stress. I think biotech is a crazy industry. Can you just share your experiences with burnout and any strategies you've developed to manage and overcome it?
Sure. Yeah, I mean, I think a couple of things. I mean, one, as I shared, I always had a very strong personal motivations, and that sort of helps you get through some of the tough days. Also, I think throughout my career, I always was fairly good at sort of oscillation of having, times when I knew, like, okay, this quarter or this month or whatever it is going to be really tough, and then scheduling some downtime after that,
Okay.
scheduling a vacation or some time away where I just completely disconnected to be able to say, okay, I'm going to get through this tough month. And then I have this thing on the other side that is going to help me, relax. I also think, a lot of people will, myself included, you look at your career sometimes and you're like, is this really what I want to be doing? Or how much longer do I want to be doing this? And I, had a great career coach that really helped me kind of sort out, what would be your plan A and what would be your plan B, right? So your plan A is you stay at Myriad, and what would you need to do to make that more enjoyable or less stressful or whatever that is? Like, how could you optimize your current situation and what would that look like? And then plan B is, really look at, okay, if you decide to leave Myriad, where else would you go or what else would you be doing that you think would be better, and really have a clear line of sight to that. And what I found after going through that exercise, every couple of years, what I realized is I did have a really great situation. I mean, when I looked at the alternatives in the plan B column, a lot of times they weren't so great. And that made me a lot more grateful about the situation that I had. But also going through the plan A scenario helped me realize that, I do have some control over my
Hmm.
situation. I shouldn't feel like, oh, I have to do this or I have to do that, or, I don't like this or that about my job. I'm stuck there, right? You have more control than you probably think in terms of, are there parts of the job that you can, delegate or, find a coworker that's really good at those jobs and kind of say, okay, why don't you do this and I'll take this off of your plate. Or, what are the kinds of things you want to spend 80% of your time doing and the kinds of things you want to spend 20% of your time doing, right? So realizing that you have more control over your current circumstances than you think also really, really helped. And so I think those things were the key to me staying there for so long. And I really had a great experience.
No, I think that's so true. I think, well, yeah, definitely play to your strengths and do what you enjoy. I mean, I look at the business I was previously at, and we just did everything. Like if for example, when I was placing you with Arcus, it was a matter of client management and then also talking to you and candidate management and working it through the whole process, finding you, shortlisting. I did everything. Whereas, you look at Avetix now, what we do is we play to our strengths. So I'm all about the management and the process throughout. Whereas I'm not actually the guy who goes and finds all the people now, because that's not necessarily my strength. You play to that, and also it's what you enjoy. Um, so that actually rings true with me, just seeing the different scenarios I've had just from two different businesses.
Mhm. Yes. Yep.
Yeah, I think this is a topic that's coming up again and again recently. As a successful woman in biotech, what challenges have you faced, and what advice would you give to other women looking to advance in the field?
A few years back at the Winter Olympics, Michaela Schifrin had this motto on the side of her helmet that said, "Always be faster than the boys." And so, and we adopted that. I was running one of our urology businesses at the time, and there were a lot of really strong women leaders in that business, and a lot of our strongest sales reps were women, and that was something that we often said to each other: "Always be faster than the boys." And don't get me wrong, I've had a lot of wonderful male colleagues and mentors, and I'm grateful for them. But it is sort of a rallying cry to say, not everyone is going to give you credit for showing up. Sometimes, I mean, that's just the way that a lot of work has been for centuries in America, right? That women aren't always taken seriously, or women always aren't always given the credit or whatever. And so I always kind of tell women, like, you always have to like work that little bit harder, or be that little more competitive,
Hmm.
or assume that that guy sitting across the table from you is going to try to give his best to be competitive. So you've got to get in there and do the same. Like, a lot of times women count themselves out, or they don't want to be as competitive, or they want to let others take the spotlight. And so I've always loved that expression of, you got to put in the extra work, you got to be willing to speak up, and you got to really sort of take your place at the table, because you're not just automatically going to be given that.
I think that mindset's incredible. To be thinking like that, I think that's a great catchphrase as well. Um, yeah, I think it's funny, isn't it? I think biotech is maybe ahead of other industries, but it's still not quite where it needs to be. By the sounds of it, I think Myriad were actually really good at it.
Yes, yes, yeah. We had a lot of very strong women leaders.
Yeah, I mean, even like, so I look at it from a recruitment standpoint, but also you guys probably look at it from like patient diversity, etc. as well. But even like in every search I do now, I've started offering an extra service, which is like, um, these are all the people we're reaching out to, and this is the percentage that are female, male, etc. This is ethnicity diversity, etc. And they actually really value that, because it means that they get they're getting a complete mix. They know that we've done our job properly, and I think the reason more people are taking us up on it is because it is in the spotlight, and it is really more important than ever, I think.
Yes. Yep.
What what are some of the other biggest challenges you faced in your career, and how did you overcome them?
Yeah, I think the biggest challenges for me were times in my career where I was not able to be so fast and nimble. And that was, when I went on maternity leave and also when I went out for my surgeries, right? Because
Yeah.
I just physically couldn't be fast, right? And so, those were times. And for me, when I was going through my prophylactic surgeries, Myriad was undergoing a CEO transition. And so that I worried a lot about this new CEO is coming in and I'm not even there. I'm out on medical leave. And, or is someone going to be trying to take my job? Or is this CEO going
Wow.
to, overlook me because I'm not there? And I remember just, like his first day on the job, me showing up at lunch and just being there and saying like, and I still had all my surgical bandages and everything, but I just was there saying, don't count me out. I am still here. And with both of those, like, I really only took 2 weeks completely off,
Wow.
for whether it was maternity leave or surgery. I mean, granted, I was given a lot of grace to, sort of gradually work back or come back part time or just take on a few projects as I was able. And so, I am not complaining about it at all. I had a great experience of being able to re-engage at the pace that I was able to. But I definitely remember those two times really feeling like it is hard not to be able to still be at the table. And how do I stay relevant and how do I stay in a competitive position when I'm not physically able to?
I think that shows how much you genuinely love it as well. Going back to that burnout question where you said you evaluated every 2 years and Myriad the right thing. I think that must have been a big light bulb moment for you, that being out of the office, how much you really just wanted to be there.
Yeah. Yes. Yeah, for sure.
And then you've had numerous successes, such as leading the Prolaris product to market. Um, what achievement are you most proud of, and why?
I mean, very similar to what we talked about earlier, just the size and scale that Myriad grew to while I was there, going from a handful of patients every day to thousands of patients every day. Really, we've tested over 6 million patients in the time that I was
Wow.
there. And the scale of the company going from 16 million to 850 million, and the product offerings that were there, right? Starting out with really just the BRCA1 gene and going all the way through to having an entire business for mental health and pharmacogenomics, having an entire business for women's health and prenatal care, having an entire business for oncology, and it not just being about hereditary cancer, being about prognostic testing and deciding therapies and companion diagnostics, and bringing the first molecular diagnostic test through FDA approval. I mean, just the size and scale of what Myriad accomplished during my time there. And certainly those are not all my own personal accomplishments. I mean, the team there is incredible. And I got to work with some of the industry's best leaders during my time at Myriad. So I wouldn't say there's like one situation in particular. I think it's just the growth of the company and what we were able to accomplish together while I was there.
That's amazing. How much of that growth is planned? Because I know a lot of the bigger companies out there, they'll do like a 5 year plan every year, and I don't know how accurately you can really say in the fifth year we're going to do this. But I just find that genuinely interesting.
Yes, I think the further you get out, the harder it is to plan, obviously. And, in the early days, we were growing, more than 50% year over year. And we kept thinking, well, when is this going to stop? Like, we're growing so fast. Do we just forecast 50% every year for 5 years or, how fast? And we were very fortunate that it went on longer than, any of us could have imagined or expected. And then you came to something like the pandemic, which none of us had planned for, right? So, we were at that point in time, we were kind of chugging along at, 10 or 15% growth, but then you hit the pandemic and, things changed dramatically, but very differently in different business units too, right? Like oncologists and, patients that had cancer and still had to go into their providers, they were still getting testing. But your, patients that were coming in for more preventive care, mammograms and things like that, those people stopped going to the doctor's office. And so some of our businesses were very strongly affected, and some of them, were affected, but not as much, or got back on track a lot faster.
Yeah, I think that's really interesting. I suppose talking about the future of genetic testing, how do you see it evolving, and what do you think? How do you think personalized medicine will play a role in it as well?
Yeah, I think as, costs come down and we're able to, sequence a lot more information, you're going to see broader and broader panels and more comprehensive panels, right? So as I mentioned, when I started with Myriad, it was like, just to get BRCA1 testing was, a 5-week process, right? And it was hard and it was expensive. And now, we offer a panel of, 50 genes for patients that are worried about their family history of cancer. But I think that's only going to increase as we look at things like whole genome sequencing and whole exome sequencing, that we'll be able to, especially, like, I think about it in the pediatric setting, right, where often a child comes in and it's just really difficult to understand what's going on with that child. And we used to, back in the pediatric clinics, we used to just, okay, let's try this or let's try that, or there's only one academic medical center in the world that offers testing for this, and we can see if we can get them enrolled in a research project. And now they're able to walk in and the pediatricians are able to order, 1,000 gene panel to see, okay, of the 1,000 possible things that this could be, what do we see? And you're able to get those results back. They're usually covered by insurance, and you're able to get them back quickly. And that can really alter early intervention for disease. So I think it's just allowing us to be much more expansive in what we think might be going on and get to a diagnosis so much faster.
Amazing, amazing. And then this goes back to an earlier conversation we had, but throughout your career, you've always balanced various roles from sales, marketing, operations. How did you manage these transitions and ensure success across different functions?
Yeah, so as I mentioned earlier, I always had one part of the job that I knew really, really well, and one part that I was learning. And so that was critical in that I would have some credibility and I could bring in some different perspectives. So, for instance, when I moved from a more commercial role into a more lab ops role, I had very deep knowledge on, the clinical impact of the testing and why the testing was so important. And that was able to sort of inspire and motivate the team because I had that credibility. But in terms of, some of the, especially like the lab automation. I mean, last time I worked in a lab, it was all hand pipettes, right? So I had a lot to learn with respect to sort of modern clinical, high production, high throughput laboratory testing, right? And so for that, I think it's a matter of sort of being humble enough to admit, like, here's a space I don't know anything about, and I'm going to need your help to teach me that, and to sort
Yeah,
of be open and vulnerable and transparent with some of your direct reports that know more about the subject matter than you do. But what you can do is ask really good questions, right? So that it often, a lot of it, I had to adjust that I'm not going to know the answer to this. But if I can be a good thought partner to the person who probably does,
yeah,
then we together will get to the right answer.
yeah. I think that's really good advice. And then, yeah, down to the last question. What advice would you give to your younger self trying to make it in this difficult industry?
Say slow down. I think, we all have this sense of urgency. And I know, especially, when I was younger, I just wanted to accomplish everything in the first 5 years, right? And, in that effort to sort of, justify my place at the table, I always would, okay, do I know the answer to this question right away? Or can I speak up? Or can I say something, right away? And I was in a real hurry. And, the older I've gotten, the more I've realized that slowing down actually helps you be a lot more successful. When you can take your time and be a lot more thoughtful about your answers, you often get to the right answer. And so I finally sort of told myself, like, it's really about being right, not about being right now.
Amazing. Amazing. Thank you so much, Nicole. It's been an absolute pleasure to have you on. And fascinating.
Absolutely. Thank you so much for your time and the opportunity. And I hope some of this is valuable for the generation to come. Really excited about
No,
the
definitely.
new
I
leaders
found it
that
so
are coming up
interesting.
in biotech these days.
Yeah, amazing. Thank you so much, Nicole. And please like, subscribe to the BioHub. Thank you, Nicole.
Thank you.